Well, hello, everyone. This is Dr. J, host of the Sexuality Space. Welcome to our live event. My silent co host, Misha Elliott, is preparing the tweets for today. And as everyone is gathering into the live space, I wanted to share some information for those listening to the replay. If you're new to the Sexuality Space, we're live every Wednesday noon on Twitter. And I have worked to create a sex positive community where we talk about all sorts of sex topics and we meet CEOs of sex companies and sex educators and researchers and writers. And I work to integrate sexuality in everyday life by being seen in the daylight doing my work. And I welcome to you all. This is a reminder that this is a recorded space. I see some of our regulars. Hello, everyone. Today, we'll chat with our guests before we take speaking requests. And please note that the space is now equipped with its own chat feature in the bottom right-hand corner, so you can ask questions as you go along. So it was 1 month ago that I talked about elements of writing sex and scenes from my upcoming book, How to Write Scenes with Sex, A Writer's Sexuality Guide. And then I left for a mountain retreat where I still am, but I'm in a locale that should keep us connected. I am very excited to welcome my friend, Dr. Melissa Monroe, to add to your sexual knowledge base using an Eastern lens focus on sexuality. Hello, Melissa.
Good morning. Oh, it's noon for you, but good day, everyone. Nice to be here.
Well, I'm just really excited that I get to spend time with you. I love your energy. I love how we do things together. I have said that we have already collaborated before. You interviewed me on your podcast where we talked about grief and sexuality. So some of my folks may not know who you are. So why don't you let people find out a little bit about you? We'll just start there.
Okay, I'm Melissa Monroe. I am a doctor of classical Chinese medicine, so acupuncture, herbs, all of the elements of Chinese medicine. I lost a daughter. I have a daughter that's still alive, and I lost my 2-year-old daughter in 2013, after which she died in her sleep for no identifiable reason. And so I've done a lot of advocacy for grief and trauma patients since then. I did a therapy called EMDR, which really changed everything for me. I was dealing with a lot of PTSD because I found her. And EMDR and writing and acupuncture and things like that really made a difference for me. So I do a child loss chat space on Thursdays where we discuss topics of around grief and trauma. And I've turned that into a podcast called This Club Sucks: Grief Support for Parents After the Lasagnas Are Long Gone. And I have a book coming out soon. And I still treat patients in my clinic. And that's about it, I think.
Well, that sounds wonderful. And I saw that you did some wonderful work with our comrade, Rachel Thompson, to get some information going about book marketing. So I'm really excited to hear where this is going to go. So, for me, when I look at sexuality, I think about how I got here on my journey and the places that I learned, where I trained, and that sort of thing. So I'm kind of interested in how you got into the field and the sexuality focus specifically, and what you got in your training related to that.
Okay. I got into the field because I was on the Western medical path. And that's a long story, but I'll try to make it basically great disillusionment with the business of medicine. I'm in no way anti-Western medicine. But this was in the early 90s. And I just knew that I was not going to be, I was going to be pissed every day of my life if I worked within the business of medicine, because it became clear to me that the doctors are often, they spend their whole lives and insane amounts of money training only to be hamstrung by institutions like the pharmaceutical industry, the insurance industry, lawyers, et cetera, et cetera. So I made a lifestyle decision, really, which was like, this is not going to work for me. I also had some injuries that were not being helped by Western medicine. I've always been a dancer, and I had some dance injuries, and I wasn't being helped. And I found acupuncture and Pilates and yoga, and so I moved to LA, and I did a Pilates and yoga teacher training, and I started that business. And until it was going well enough to put myself through acupuncture school. So that's how I got into the field. As far as the sexuality aspect, it's something I've always been interested. I was always the friend that people came to talk to about that stuff, which was really weird because in college I was, I was a virgin until I was pretty old. So I don't know why they came. I don't know why they came to me. I had not a lot of experience, but I guess I was a good listener, I suppose. And nothing really phased me. But then once I was in the field of acupuncture and I was doing my PhD dissertation, I did it on causes of infertility around the hypothalamic ovarian axis. So hormonal causes of infertility. And
Wow. You've done
yeah.
some cool things, but first I want to pause and say, I know why people talk to you. You have the most wonderful, inviting laugh, and people just like sitting with your energy and know that you have this, non-judgmental direction that comes right out of you. And so I want you to hear that from me because I think that's really important in the process. And boy, you got technical with your PhD. Mine was about mother and daughter relationships. I kept it nice and broad. You went really specific.
uh, Yeah, I was always interested in the interaction between the autonomic nervous system and the endocrine system. Since I was a kid, I recently found when I moved, I knew I was always interested in it, but when I was moving, I found a found a picture. I was a massive dork, by the way, in case that's not super obvious by listening to me. But I found my science fair photo. I won some awards for my science fair, and it was entitled "How Mental Health Affects Vital Signs." I think it was 12 or 13 years old, and I looked super dorky in it, and I was really proud. And I read Hans Selye's book, "The Stress of Life," for it, and all these other books. And so when it came time to do my dissertation, my committee was like, "Oh, you need to use this book," and I was like, "Oh, I've read that book. Oh, when I was 13."
I
This
love
might
it.
have
I
been why I
love it.
was a virgin until I was very old. But anyway, so yeah, I was always interested in that connection.
Well, I'm curious, did you feel like the training that you got using this Eastern lens was positive in being able to talk about sexuality specifically to work with your clients and patients?
That's a great question. And I will answer honestly because my school closed. um, Sadly, I went to the what was the oldest school of acupuncture in the United States, but it sadly has closed. Our and I think, in fairness, I think this is true in medical school also. You're really just learning the basics there, and then any kind of specialty you're learning afterwards. So the major schooling, no, not really. You're just, you're learning your chops, you're learning the basics. And in Western medical school is very much the same. And then you kind of follow your interest and find your specialty after that. Does that make sense?
Yeah, and you know what's interesting, given that I've been in this field forever, When I started out, I did specific training for physicians and physicians' assistants and nurse practitioners, and they were receiving at least 10 hours of medical training in sexuality at that time. And now I'm working with Rosie Sexual Wellness, and Dr. Harper says that now it's 1 hour and it's only focused on male sexuality. So it's really interesting to look at the broad time frame to see where sexuality sits and how we can help people become more comfortable in having a conversation when it's not even focused with the people who you would be having the conversation with, like you and me.
Wow, that's crazy. And mostly I'm shocked that it used to be more and has become less.
I
Because
know.
they
Yeah.
used to not even, I mean, when I would have gone, when I was on that path, they didn't even teach nutrition then. That was considered, woo woo that they do now. But yeah, so I'm surprised it used to be more and has become less. And I'm glad they're doing any, but uh,
Yeah. Yeah.
yeah, it's
So
so much deeper than just the neurobiology of it, and the physiology of it, obviously.
yeah, and my work has always been about how to set permission to start a conversation so people can feel comfortable to discuss a concern or a challenge or, whatever might be happening for them. But I understand that you had something really interesting happen in your training in sexuality. You want to share that story?
Oh yeah, this is a funny story. So this is, I think, the first or second day of acupuncture school, and my teacher is a very, very, very well respected teacher from China, where he was not only an acupuncturist but a neurologist, pretty famous globally, and very soft spoken. His wife is a Spitfire and like 4'8", Chuni. Chiwe, my teacher, was very soft spoken and very academic, and a fabulous teacher. But a soft spoken guy. Anyway, it was point location. It's the first day of school. You're learning where the points are, which is a lot more complicated than it sounds on the surface. And he started talking about this point, Ren 1, which is, on your taint. And he's speaking slowly because English is not his first language. And he's going on in this very soft spoken English about how to find it, how to find the point, because it's a lot more specific than just the
So,
taint.
so let me
And
let me pause you for 1 second because I do bilingual work.
mhm,
So the taint would also be known as the perineum.
yep, yep,
The space
exactly,
between the space between
yep,
for women the vulva to the anus and the men from the base of the penis to the anus.
correct.
Okay.
Yep. Yep. So he's going on and on about this. And I'm just sitting there thinking, there is no way any American is going to let you put an acupuncture needle in there. And I was really hoping we weren't going to have our classmates do it, because mostly you practice on each other. Anyway, he's still going on and on and on. And I'm not a big question asker. I usually, kind of take it in and ask questions later. But I couldn't take it anymore. And I said, come on, no American is going to let you do that point. And he and he smiled. He goes, well, one special patient. He said, a 76-year-old man with a 30-year-old girlfriend. And I was like, oh, okay. So it's used for ED, erectile dysfunction, uh, enlarged prostate, these kind of problems in men. Women tend to not need that point as much.
Well, that is so interesting, and it is a perfect segue for. Do people come to see you specifically with sexuality concerns, or is this something that you incorporate into your way that you do your holistic body information?
Both. I see probably more infertility. They'll come for quote infertility, and then they'll learn about how that's related to their sexuality. And not all cases of infertility are sexual. Sometimes it's structural, so, and some women have a heart-shaped uterus. It makes it very difficult for them. That's structural. My needles can't, and herbs, not, that's, nothing can change that. So structural problems, I can't, I can give supportive medicine, but I can't really change that. So mostly they would come for some kind of aspect of fertility, and then learn how that's connected to sexuality in general. I do get some men, because herbs in particular are very effective for uh, enlarged prostates. There's really great herbal formulas for that, and that is a very, very common problem in men, especially as they get into their 50s and above. So I do get some people that come for that. Severe cases of ED I send to a male colleague. There is like a little bit of a creepy crew out there that knows about this point and what has to happen for us to give the point. And so there is a thing where they'll call female practitioners and ask, can I have this point? And first of all, no diagnosis is assured to have any one point. That's not how we diagnose. We don't treat, quote, infertility. We treat, we look, do you have heart blood deficiency? Do you have kidney deficiency? Do you have kidney yang deficiency? And you would approach all of those are causes of infertility, or potential causes of infertility, that are kind of a stellium of other symptoms, and you would treat them all very, very differently. So when I get those kind of calls, I send them to my male colleague, and he knows what to do. And generally they don't call him.
Yeah, and that's a typical thing in doing any type of sexuality work, where you have a buddy system, you have here's the supervisor, here's how we're going to handle these specific things, so that we're clear about boundaries and we're clear about being respectful, and that we're also taking care of ourselves in the process. And so you were mentioning erectile dysfunction and enlarged prostate, and I'm kind of curious in the balance of that. I know for years my practice was really centered around low sexual desire for women. Is that a component that you do with assessment in your work?
Yes. Yeah. Women usually talk about it easier also. And it often presents with depression and or anxiety. So again, in Chinese medicine, we take a whole, but I don't just ask them about whatever their chief complaint is. Let's say it's back pain. I don't just ask them about, I do ask them about their back pain. I ask them about the ergonomics of their sleeping and their work and all of that stuff. But we have what we say, the 10 questions. We're asking about energy level. Every patient, we're asking about how many times you urinate, what your urination looks like, bowel movements. And so by the time we get through these 10 questions, it's pretty, once they've told me about their bowel movements, it's a lot easier to get them to open up about sexuality. And most women are more open to it. They'll say, I have no drive right now. The men, this is not always, but men who come in generally talk about they call it ED, or they say their prostate's enlarged or whatever. But women are a little bit more open about saying, I don't have much of a drive right now.
So I'm loving the idea, because most people don't consider the holistic nature of sexuality. And even from my Western medicine standpoint, I'm always looking at that, because I was trained as a systems therapist. And that means, I look at the cell, and then I look at the cell in which part of the body, and then I look at the body and which house is it living in, and all the people, and you're working in to out and then out to in. So when you have people come to your office, what is the most helpful thing that you find that people get from you related to sexuality?
I would say that the most, and this, it's never what people want to hear for some reason, but I would say the thing I hear myself saying the most, it relates to stress management. Um, we live in a society that demands a lot of us, and women especially. We go to work now and we run businesses and we've made a lot of progress, but that doesn't leave us a lot of time to sit in a more feminine energy, nor and men don't have time to we all have, everyone has yin and yang, and there's not just yin and yang. If you know that little tai chi symbol with the black wave and the white wave, there's a black dot within the white field, and vice versa. As there's yin, there's yang, there's the yin and the yang, and the yang and the yin. And so even if we identify as female, we still have some masculine energy. Even if you're, the most alpha dude ever, we all have masculine and feminine energy. And when that is out of balance, you have problems. That's the most base uh, core principle in Chinese medicine. Western society demands a hell of a lot from our young, and really leaves us feeling like we have to have permission or rationalize. I mean, even I do it. Like I find myself rationalizing the need to rest or do something that feels good or something that's soft, um, to be more in my yin. And so most of us are not there enough. Then you have meridians. There's a thing called liver chi stagnation, and pretty much everyone that walks in my office, everyone that has a job and or kids, or a significant relationship, we just are in a culture where that is really almost unmanageable. We're just, we're kind of trained to produce, consume, and it consumes our energy, our vital energy. So the thing I find myself talking with people about the most is their overall stress management. That looks different from person to person. And then as I bring it up, then immediately they start rationalizing with me. Well, I've always gotten 4 hours of sleep. Well,
Yeah.
I've always, and I'm like, and it's never been a problem. And Rachel knows this. I've talked to Rachel about this before. Like, well, it is a problem because you just listed 10 things that are wrong with you. You just don't want to think that the lack of sleep and the lack of stress management is contributing to these problems, but it is, I promise you. So I think stress management and time to just be a human is really, I think, the biggest obstacle for most people, sexuality rise. Because if you don't have time, it's not like you can come in from especially women or people who identify as women. You can't like come in from like, slaying dragons all day long and then just be like, oh, I feel so sexy. It's just not how it works. And I don't even think it's that easy for most men, unless for them sex is just a release for it, but it's not going to lead to meaningful sex generally. So
Yeah.
stress management, I would say.
Well, I resonate with that so much as I sit here on this mountaintop, having been here 4 weeks, totally out of
I'm
my usual
so
place.
jealous.
And let me tell you, I have hiked every single day, and I have this dog that's making me do things. So, you have a four-legged person with you who's going, yeah, yeah, come on, higher up, keep going. So it's a different world. And I think for me, listening to what you were saying, yes, stress management is, the place that I've always seen sexuality, because I think women and men in general don't get permission to talk about sexuality, where it sits for them, how it's important to them, how they want that integrated into their life. And it's funny. So now I'm going to tell on myself, yes, I've been on a retreat, and Misha's probably going to be laughing like crazy because I came here with the intent of having some time to do the last edit on this book, and that hasn't happened. And it hasn't happened not because I'm in this wonderful place and all that. I actually had no place to sit the book. I don't have a table that's workable so I can do this, but my creativity wouldn't stop. It's like every time I walked outside, more energy, get this idea. I've created this entire new project that relates to what you're talking about. And it's something that I never intended to do. And it's an oracle deck, and it's all specifically related to feminine energy, what the elements are, energy surge, good things that women can tap into, and then 9 topics of sexuality, looking at the physical, emotional, and mental and spiritual. Because, like you, women need to be able to have a space where they pause, they downshift, they make a transition. And I'm hoping that this tool is going to be one of those things that helps us get that balance back in our everyday life. How's that sound to you?
I love it. I'll be your first customer.
Absolutely
No,
love it.
I'm the first customer.
Okay,
Oh,
I'll be second.
okay, y'all can fight over. This will be good. So let me reset the room. We've been in 30 minutes. This is Dr. J, and you're in the sexuality space with me and Melissa Monroe, and co-host with the mostest, Misha Elliott. And I welcome all of you here. Thank you, my regulars, for being here. I see all of you, and it's wonderful. Melissa, Misha has put some of the specific things up in the nest that you were talking about, and she has a connection for your podcast, so people can see that up in the nest. You also identified 2 interesting resources that related to food and related to breathing. So I would love for you to address either of those.
Yes, happily. So, when I'm working with the patient, like I said, we're working on it from all angles, and I'm diagnosing them from all angles. I ask them about energy level, sleep patterns, urination, bowels, what they eat, what they don't eat, whether they're hydrated. All the questions that people want to poo poo. But when you ask them these same questions every time, they start to learn, if they're coming regularly and they're coming, let's say for something that seems unrelated to them, let's say it's back pain. But you're asking them these same questions every time, they start to, no matter how much they think it's bullshit that I'm asking about urination when they came in for a back pain, or, a libido or energy level, after a while, they start to realize that their answers to these questions change, and that the way they feel, oh, I notice that like when my urination goes up, I have more back pain. It's not there's no causation there, but they present together. And so they start to learn that on their own. And when I do breath work with all of the patients, but breath work for sexuality is different. And there's kind of 2 schools of thought on that. Some people talk about coupled breathing, where you're like syncing your breathing. And by the way, if your partner is someone that says, oh, this is too woo woo, I don't want to do that. The beautiful thing about breath work, couples breath work, is that they don't even have to know. If you know what you're doing, you can quietly sync your breath to them, and you will not only relax yourself, your partner will start to relax and not know why. So it's noble ninja medicine. um so
I love
that's
it.
so that's one way. And then the Taoists talk about alternative uh, breathing. So when one partner is exhaling, generally you're sitting face to face. Maybe the person who identifies as a woman is sitting on the lap of the person who identifies as a man, or it doesn't really matter. And that's the beautiful. It doesn't matter who is physically a woman, who's physically a man. That, like, none of that matters. If you've decided that this person's going to take on the more masculine role, this one's going to take on the more feminine role, that can be a woman or a man. It doesn't, none of that matters. But one, as one exhales, the other one is inhaling. and on and on. It can be a little bit tricky to get going, but that's good. Um, you know, Americans are often quick to quit or dismiss anything that doesn't seem intuitive right away. But that's where the juice is. That's where the magic is. Then you can take the alternate breathing. Even this helps to establish polarity, which I know is a big topic right now. And there's some great polarity teachers out there, and there's some like creepy ones also. So just be careful if you go too far down that rabbit hole. There are I've noticed a lot of examples of there's some predators out there, so just be careful, ladies especially. But alternating the breath, and again, your partner doesn't have to know that you're doing this. If your partner is just like, nah, like, that seems too weird, I don't want to do that, they don't really have to know. You can just alter your own breath, and you're not hurting them or yourself or anyone by doing this. And that works to kind of establish polarity, which is really important for arousal and to turn up the heat. And then there's more complicated ways that you can do that, where on the exhale you're saying your partner's name, and if you're alternating it, then one is saying A is saying B's name, then B is saying A's name, because it's alternating. It takes turns, if that makes sense. So that is some examples of breath work. And again, there's two schools of thought on which one is better. This is an opinion though. My personal opinion is the synchronous breathing is a great way to get out of that warrior mindset we were taught. Like, everyone's been at work and they're crazy and they were just in traffic, and now you want to get busy and everyone's just like stressed out and everything. That, to me, that's a perfect time for the synchronous breathing. They kind of come into each other's space. And then once you want to, turn up the heat a little bit, then in my opinion, that's the time for the alternate breathing. So that's breath work. And what was the other? Oh, foods. You asked about foods. Okay.
Yeah,
so
but hang on 1 second before you get to food. I wanted to comment on what you said there. The breathing part has been something from a therapy standpoint. I did a lot of work with neuro-linguistic programming on the front end of my practice, and it was always interesting when people would walk in the room and the energy was that fast paced, and it's like how to slow things down, and all of that related to being within someone's space. If you start changing the body posture, the breathing, it slows the other person down. So I think you're making a wonderful statement for how to get into present time with two people together by doing the synchronized breathing. And I think that's really important. And I like that the other is specifically for fire. So, yeah, I like how you put both of those out there.
Oh, thank you. I mean, there are people that would argue with me about that, and I welcome the argument, because if people are getting it on, everyone wins. I don't really care. Like, if the other way
That's
works for
right.
you, that's great. I don't. You do you. I just find in my own life, and from what my patients report, that the coupled breathing is, and that can work with anyone. It can work with a coworker. It can work with you. It's really great for children,
Yes,
including
yes.
teens. If you got a teen storming around the house, I mean, it, of course, really works for young kids. But if you got a teen storming around the house, and you can get close enough to them to kind of, you don't have to tell them, kind of just start to time your breath. And as they get a little closer, it will start kind of happening naturally, and you'll see them, become less dickish to you. That's my free parenting tip for the day.
Okay, cool. Less dickish. I love it. Okay, so let's move into food. So we know that people believe all sorts of wonderful things about food and sex. So give us your perspective.
Okay, this is a bit tricky to do generally, because again, in Chinese medicine, we don't say like, oh, you have anxiety. Anxiety gets these points and these foods and these herbs. That's not how it works. We're looking at all of those other questions that I'm asking to see what kind, is this person heart blood deficient? Are they, and I know I'm using terms that won't mean much to anybody, but it's how it works. Or is this person heart blood deficient? Are they kidney yin deficient? Are they do they have an excess of liver qi stagnation that's pouring into another meridian? Once you determine that, then that determines what points you prescribe, what herbs you prescribe, what kind of body work you prescribe, what kind of foods you prescribe. So this is a little bit difficult to do globally, but I will try. So with
But you know
men,
what? You know what you're doing, Melissa? You're also giving the process. So if anyone has never been to work with acupuncture or Chinese medicine, you're giving the process that is holistic, which also shows the wonderful individual nature with which you were working with the person sitting in front of you. That's a valuable piece of information.
yeah, and that's true for whatever their chief complaint is, whether it's neck pain, back pain, erectile dysfunction, infertility, anxiety, depression, whatever, recovering after a heart attack, recovering from broken, but whatever it is, the approach is the same. We don't treat all broken bones the same. And by the way, if you break a bone, go to the ER for God's sakes. So if you have a heart attack, go to the ER and then come to me after. But also come to me before and you might not have those problems. And if you've missed the window to come to me before those problems, come after. I can help with the healing process so that it might not happen again and support you through lifestyle changes and things that need to happen. But there is a place for Western medicine, and broken bones and heart attacks are two great things for
Yes.
that. But definitely come to me after to reset your body so that the conditions that led to those injuries and health events don't repeat themselves. So broadly for men, if there are any kind of arousal or fertility issues, zinc is really one of the most important things. And you can get that from oysters and most kinds of meat. So a little bit tricky for if you're a vegetarian, and even trickier if you're vegan. But oysters, beef, pork, beans, salmon all have a lot of zinc. Pine nuts. So if you like pesto, which I do, pine nuts are really good for testosterone levels and all the male parts, black raspberries, avocado, and this is all in some articles that have been posted. Watermelon, extra virgin olive oil, broccoli, most seeds and nuts, particularly pumpkin seeds, uh, beets, apples have quercetin in them, so those are great. Wine, but they will all of these lists will put wine, but it's very important. I mean, we've all heard of whiskey dick. Wine, but not too much wine. Like a glass of wine, not the bottle of wine. The bottle of wine is going to start to have diminishing returns, so to speak. So, and that's true for the ladies also. So don't get too smug, ladies. Um, and for the ladies, zinc is also important. Zinc, ginseng, and I would argue that ginseng is helpful for men also. If you have a heart condition, you need to be careful. And for all of these foods that I'm mentioning, obviously, if you have allergies, like don't do it. And if they're ginseng and ginkgo, which are listed with the women's foods that can be helpful, there are conditions where those are contraindicated. So you do want to talk about these any kind of major changes or additions you want to discuss with your personal healthcare provider who knows what medications you're on, who knows your entire medical history, etc. But generally, ginseng, ginkgo, saffron. So if you like curry, like I do, I would eat curry off your shoe. I love curry so much. Saffron, chocolate. The, the research on chocolate is kind of mixed, but what the hell, go for it. Figs, avocado, fenugreek, but you have to be fenugreek is another one that you want to discuss with your individual health care provider because it is contraindicated in certain parts of pregnancy. It can cause some people have problems with it when they're nursing. Other people have great it really helps them while they're nursing, but definitely if you're adding fenugreek, discuss it with your provider. There's a new, well, it's not new, it's old. There's an African herb that's getting a new attention called uhimbine. Uh, People are starting to use it. There's not a lot of research. It probably won't hurt you, but I like for things to have a little bit more research before I start taking something every day. Then some women, especially if they're coming for infertility or they're of a certain age, start to see declines in their yin. It's just something that happens with women as they near menopause, and it happens sometimes in younger women if they have just been a workaholic or they could be constitutionally that way. Foods that promote yin, which you definitely want if you want to promote sexuality, and you definitely want if you're going to promote fertility. Yams, seaweed. You want to avoid wine. Vodka's okay. Tequila's okay. And again, one glass. Don't go nutty. Mussels, oysters, eels, grains. It's not a good time to be like, I'm not eating, any carbs. No, you need it. You need the carbs if you're deficient in yin. Nuts, seeds, and of course, fruits and vegetables. So that's just kind of like a general picture.
I love it. You should see my note page right here. This is this is so cool. Well, let's see. I have one more question that I'm going to ask you, and then we'll open it up and see who'd like to come and ask you any specific questions. But, there's so many things that we could talk about. Was there something that you wanted to make sure that you brought up that I haven't asked you about?
I'll kind of just run down quickly the rest of the stuff that I had down, and then people can ask for clarification. You mentioned slow down, and it is one of my, I have 1, 2, 3, 4, 5, 6, 7, 8. I have about 15 bullet points, and slow down was the first one. Everybody's got, if you want more fire in the bedroom, you got to slow down, and you got to slow down before it happens. If you treat it like another thing on your to-do list, and I tell this to my fertility patients, it's going to be difficult for you to become pregnant as a couple if you're both treating it like this task on your to-do list. It's just the mentality, and that people think that's woo-woo, but it's really not. And even Western doctors will say this. If you're treating it like a chore, you're not going to have the same results. So slowing down is super, super important. Massage of yourself, of your partner, paying someone to do it, very, very helpful. It helps your body learn how to respond to touch first. I mean, think of it, and this will help justify the cost if you if you go do it. It really does help you learn how to respond to touch, helps you learn how to let go, helps you learn how to dissolve tension, helps you become more responsive, which is so important. And so instead of thinking of it like a luxury, think of it like you're teaching your body to be a badass lover. You got to change your focus. Hydration is so important. And people are like, yeah. Like people think because they know something, it's the same as doing it. So when my patients go, yeah, I know. I drink water. Do you drink 8 glasses? I don't know. Um, I'm like, oh, I'm going to tell you, you probably don't, because you just said that this is a problem and this is a problem and this is a problem and this is a problem. So I'm guessing you don't. Why don't you do me a favor and track how much water? Oh, I wasn't drinking enough water. Yeah. Knowing that we need to do something is not the same as doing it. And as I tell them with their herbs, buying the herbs is not quite as effective as consuming the herbs. It's a great first step, but they don't work as well sitting on your shelf as they do if you take them into your body. It's a whole different dealio.
I love the doing, Melissa. You were right on.
You're asking an awful lot of me. I have issues just taking a multivitamin every day.
Well, like you can make it fun. You can get one of those water dispensers. I do this for my daughter is sorted out on her water now, but there was a little period where she wasn't. You can get one of those pretty water dispensers and, put some cucumbers or some mint or some strawberries or some lemons or whatever and make it fun. If it's sitting there and it looks pretty, you're going to drink it more because you're going to feel like you're at a spa and you're like, oh, but we have to treat ourselves that way. We tend to wait until it's somebody else's idea to be nice to us. But
Absolutely.
treat yourself like a queen, and the rest will follow. Vitamin D is critical. Vitamin D is it's part of a whole hormonal process. Many of us are low. It's very easy to get a vitamin D level check at the lab. Any PCP, most of them are doing it now without being asked, but they'll all do it if you ask. Most of us are a little low. So getting either vitamin D through sunlight or supplementation, it's difficult for most of us here to get enough from sunlight. And then there's also a cancer, there's pros and cons. So vitamin D, adequate sleep. And this is where I see like the most justifications for bad habits is sleep. But we have a growth hormones surge. If we're asleep from the hours of 10 to 12, that's generally when the growth hormone surge happens. None of us are growing, anymore. I think everyone on this talk is an adult, but growth hormone is not just about growth spurts. It is involved in cellular repair and all the things that happen when we sleep. If we miss that growth hormone surge, we're missing a lot of our body's ability to heal for free. So sleep is not only fun and free, it really is healing. And if you if you do it right, you're going to do a lot of healing that will cost you thousands and thousands and thousands and thousands and thousands of dollars and annoying appointments and all kinds of stuff. So sleep, it's free and it's fun. Communication, obviously, I'm sure you've had a million spaces on that, and confidence. And if you're taking care of yourself and you're making yourself the fancy water and you're slowing down and you're letting yourself get massaged and you're doing all these things that we're trained to think of as luxuries, you're going to feel more confident. And if your stress is managed and you don't feel like, my life is crazy, I can't keep up with it, you're going to have more confidence. And nothing sexier than confidence.
Wow, you stopped. Is that your list?
That was my list.
I love that list. That is just primo list. So we have 10 minutes left. So is there anyone who would like to request the mic to join us here and see about any other questions? Misha, I am sure you don't usually talk, so I'm just thrilled that you popped in twice today. Is there something you wanted to ask?
I warned my neighbor that I might be talking to the voices in my head.
Oh,
We're alone in
good.
the dark today. So I thought I'd say hi.
Excellent. What do you have a question for Melissa?
I'm good. I love everything that she shared with us. I plan on checking out her website, and I'm actually got my bottle out to take my vitamin today and be a good girl.
And I
And
see that I see that you posted Melissa's website in the chat
in the
feature,
chat,
so
yep.
people can see that
And
there.
I shared that in the Nest as well so that it translates over to the Spaces dashboard. And then I was actually checking my local spa so that I can get my massage scheduled that I still haven't taken from my birthday gift card.
Perfect. So we're doing the moving to the doing part. So I'm happy Melissa has prompted you in those directions. I see my friend Jacques has come onto the stage. Hi, Jacques. How are you today?
Oh, good morning. Um, Thanks, Melissa. You've basically confirmed and reiterated my experiences with having acupuncture performed on me. I first started with it when I had some nagging old football injuries that I had to have taken care of. And then later on, I did it for spiritual reasons, for chakra alignment and balance with my body. And what you're saying about rest, massage, diet, and hydration is spot on. That's what I've experienced with my old acupuncturist. So thanks for sharing and the reiteration and reminder.
It's my pleasure and privilege. Thank you for being here.
That's all I got.
Jacques, thank you. That's all you got. Well, it's great to see you in the space, and I hope life is doing well for you. Excellent. Um, we have another speaker who has come onto the stage. It is my friend Poppy. Hello.
Hello, good people. This was really fascinating. I love when you click on something, you think, I think I'm sort of interested. And then by the end of it, you're like, oh, I'm really interested now. So thank you,
Oh,
Melissa, very
good.
much. Okay, so my question is, I went for acupuncture for a while. I would say maybe a whole summer, and I can't really recall. It was something about my allergies, and I was just having a bunch of chronic illness problems. And I wonder if Melissa can comment on when you do these sort of complementary therapies, the speed at which they might or might not work, and how we can process that in terms of looking for one that is right for us.
That is a tricky question, and this is never what anyone wants to hear. So I apologize in advance. That is a tricky question to answer broadly because it is so different condition to condition, and it's so different person to person, and also a lot of it has to do with compliance. How much of my advice they're taking and how much of my advice they're admitting that they're not taking, so that I have an accurate picture of what might not be happening and what is happening. So it's really almost impossible to answer that broadly. I will say if it's for allergies and asthma, one of the best things you can do is get treatment like every day or every other day for 10 days during the hottest part of the summer to kind of protect you through the flu season. And I know it sounds weird, but but it really does help people. Um, the Yeah, I'm so sorry, Poppy. It's really hard to answer that broadly. I will say that in general, acupuncture and herbology are not flamethrower type treatments. It's not like it's not magic. And it just blows my mind that how many people that come in for the first time and think like, oh, I had a little relief, but it didn't really work. I'm not coming back. But they've been on medication. They've had 4 surgeries and they've been on medication for a decade or more, but they expect me to get them better in one treatment. I can't undo a decade's worth of damage in one treatment. It does take some time, and acupuncture works and herbs also work by bringing us back to homeostasis. So it's not a slingshot thing like Western medicine can be sometime. And even the slingshotty kind of treatments in medicine where like you're taking a pill and you're feeling very different very quickly, there's still a healing period involved with that. So it does take some time. Now, if someone has like a twisted neck or so, my neck wasn't hurting yesterday and it is today, like I can, that I can take care of. And they probably slept funny or, they lifted a box funny or whatever. I can turn that around in the session or two. But most conditions that people come for, the table has been set for a long time and they've been adding
Yeah.
ill-advised dishes to the table for a long time. And so you can't really, it's not magic. It is, and it is a collaboration. Like the patient has to work with me and honestly report and start to, really notice how different things affect them. So I'm sorry I can't give you a more definitive answer, but it's just it's so varied.
No, I think it's a really good answer. And I wonder too if we should look for practitioners who lay that all out and don't pretend to be gods on earth, but just say, here's why it might not be overnight. But, it's pretty pricey. And that's another worry that I have sometimes. So in America, healthcare, even if you have health insurance and you're going through traditional medicine, the copays can be so high. A lot of these treatments are out of pocket. Like I can't get a lot of them covered. So I wonder, sometimes I'm in the midst of it and I know all of what you just said and I know it's not overnight and I'm showing up and I'm 100% believing in it. And then I think, I don't know if I can afford another 7 months of this or 10 months of this. So how do you have any advice for kind of getting your mind around all those challenges?
Well, I would say that there, like, for if you're coming for pregnancy, like you'll be going for 7 to 10 months, but or maybe cancer, but most problems won't take quite that long. There are acupuncture schools that you can go to where the interns are doing the treatments, but they're supervised by the professors and so forth. Those are usually sliding scale. So that's an option. But I have patients that come every week, whether they need it or not, because what they have found is that they spend less money on their health care overall if they are, because technically acupuncture, herbology, Chinese medicine was created to be preventative. It has had to adapt to Western society because we have a sickness based healthcare system. And so that is the mind frame that people are coming with. Like they come when they are sick. But back in the day, the emperor's physician was paid when the emperor was well and was not paid when the emperor was not well. I mean, imagine if it would turn our entire economy on its head. And I'm here for it. Like if that ever happens, I'm going to be dancing naked in the streets. I will be, if I live long enough to see the collapse of the insurance industry, you will never see a happier bitch than this one. But I don't know if it's going to happen in my lifetime. But
Melissa,
so
I want to say that the point that you're making in addressing Poppy's question is probably something that all of us can gain from, in that you are really giving us a perspective and a specific mindset to look at what's going on in our body, whether it's related to sexuality or any other issue, to think about it in a holistic way that Western medicine does not necessarily give us. So you're giving us another way to put it together. So I really appreciate that. And I see that we have a lovely person who's come to the stage. Hey, Rachel Thompson, how are you today?
Hey, I'm good. I'm so glad that you're back and I was able to make it, though
Oh,
I'm
thank you.
completely jealous of the fact that you got to take a whole month-long retreat. Can I sign up for next year?
Yes, yes, yes.
This has been really fascinating. I'm so glad that Dr. Melissa is here. She's fantastic. And all of this information has been really, really helpful. Especially the little things that I think we forget that could potentially contribute to what's going on in our personal relationships. Like you were saying, Melissa, we've talked about this, just drinking enough water. So here I was thinking I was drinking enough water, and then I end up with a kidney stone. And my urologist says, yeah, I need you to drink double what you're drinking now. And I think I was having like 6 8-ounce glasses. And so, I was like 50 ounces. And she's like, no, it should be over 100. And I was like, oh my God, are you kidding me? But that's the kind of stuff that we don't even realize. If we feel dehydrated, then we feel kind of yuck. And then we're not interested in any quote unquote fun activities. So there's a lot of little things that I think we can do every day that we don't realize that can contribute to our general overall well-being and health, like drinking water, like stretching, just basic, get up and walk around. I mean, a lot of us work from home, so it's a challenge for me to get my steps in every day, but I make myself do it because otherwise I'm just going to become a potato, I don't need
I
to be a
love it.
potato.
And I think you're right on, Rachel, is that sometimes we just need those little reminders, whether it's the list for all of these things come into play for how we feel physically, what our emotions are, what thoughts we're thinking that day, how we're aligned in a direction with our universe and our higher self and what we're doing. And those are all things that play into the fun activities that we'd like to be doing. Misha, you put your hand up. You don't have to do that.
I didn't want to interrupt you, but I highly recommend setting alarms if you work from home to get up and do something, whether it's to take 15 minutes and wash some
Yes.
dishes or put them away, run the vacuum in a room, fold
Yeah.
laundry. Like
Yes.
every hour, get up for 10 minutes and do something. If you have a Fitbit or a smartwatch, you can even have it tell you at 10 minutes to the hour that you need to take 250 steps. So
Well, you're
try
using
that
that
too.
AI and technology. I love it. That is the
Very,
perfect thing.
trust me, I used to have to set alarms at noon to make sure that I ate lunch. And that was when I was working in an office years ago because I didn't eat lunch.
Yeah, that's an
So
important
and
thing.
once you get yourself trained, you don't need the noon alarm anymore to eat your lunch because your body's going to tell you, hey, it's like 11:45, 11:50. Are you thinking about lunch?
Perfect. Perfect. Well,
That's
thank you
great
for that,
advice.
Misha. Yes.
Um,
So, Rachel, I was going to say thank you for you coming on to the spot. And Melissa, we're getting close to time, so I want to make sure you get to have the last word for whatever additional information you want to give us.
well, thank you so much for having me. I wanted to go back to Poppy for 1 second and say, and reiterate that my patients who come every week report to me, and I've seen it happen, that they spend less on healthcare overall when they make that a priority for themselves. And maybe it's not acupuncture. Maybe you decide it's a massage, or some weeks you're going to get acupuncture, and so for some issues, the acupuncture needs to be regular, and for most conditions, they need to be close together. The closer you do them in the beginning of your treatment protocol, the faster you'll get better. Like starting on a go once a week method is not going to advance you you're going to constantly be chasing the tail of the tiger. It's better and more um, you'll save money by doing them closer together in the beginning of treatment before you space them out. So I wanted to just say that really quickly. And then Misha, yes, I tell my patients who sit at a desk all day that have any kind of physical, injuries, I have them set, or who have heart problems, I have them set an alarm. Like once an hour, I want you to just breathe 10 times. And I give different breaths to different people depending on what's going on. Or if you're having eye problems or migraines, or because you're staring at a screen, I have them once an hour. You've got to pull away from the desk. You've got to stand up. You've got to look at something that's about 100 yards away for, a minute, because your eyes work more to see things close than they do far away. You got to let your eyes rest sometime, or you're going to create all kinds of headache, eye problems. So that's setting an alarm. I'm so glad you brought that up, Misha, because it's something I tell my patients all the time. And some of them I tell them to stretch once an hour. It depends on what their problem is. But yes, use that little alert on your phone. And then there was something that I was going to address with Rachel, and I can't remember what it was. Stretching. Yes. I realized that one of my little bullet points that I didn't read because it was under breath work and I had too many notes around it. Exercises for sexuality. Many of us don't exercise enough, or we don't do the right kinds of exercising. Like I'm not saying running that women shouldn't run, but running can cause a lot of problems for women. Hiking's but it's I also know that trying to get a female or any runner to stop running is it's almost harder than to get a heroin addict off heroin. It's really hard to get the runners to stop running, but even if they are completely trashing their body. But exercises like pelvic floor exercises like Kegel, interrupting your stream of urine while you're peeing, doing that a few times is really helps build up the pelvic floor, and really great for men's prostate, etc. Controlled ejaculations, hip bridges, hip stretches, all of that stuff helps increase blood flow to the area. I mean, we should all be stretching anyway for about 5 billion. I mean, I could do like 58 spaces alone on why you should stretch, but particularly if you have arousal problems, those pelvic floor and hip stretches are really important.
Excellent. And I was thinking that I always talked about it as the traffic light item. When you have a traffic light, you just can practice your Kegels at that point in time, and that's part of the process. So, the physical body is important, and where we need to focus the blood flow that goes in that's going to support us in the arousal and desire components, and that's really, really good. So, Ramon, I see you snuck in here at the last minute, so you're going to have whatever your comment is, feel free to let it fly, and then we're going to be closing up.
Thank you so much, Dr. J. Great to have you back.
Thank you.
Yeah, two quick things. And by the way, love the topic. Yes, it has been a matter of, the person mentioned money. For me, it was a matter of really just talking to professionals, assessing what my issues were in totality and what the plan would be. And I didn't realize the effect it was having till I've done all this travel this year and wasn't able to keep up on my hatha yoga and some of my other things. And boy, it sure showed up fast. So you're right. I agree with the woman that in the long run, the reduction in other expenses or medicines has been well worth it. Not to mention how holistically better I feel. Women in running, hey, I've got a bone structure issue I was born with. So for me, running is tough as well. I use an elliptical at the gym or some other equipment where I'm not getting the impact and the motion that running does to me. So that's been my solution for that. And, I still get, because I need that exhaustive workout. I hike a lot as well. So anyway, wanted to drop those in. Great topic. Thank you, both of you.
Well, thanks, Ramon. Melissa, you get the final word here.
My final word is just thank you for having me. I had a great time. I appreciate you all being here. I appreciate the chat, Dr. J, and I appreciate your work in general and for making sexuality something that people don't feel like they have to. I mean, we're all grown ass people. Like we shouldn't have to feel like we have to sneak into the bathroom to ask basic questions. And also, we're so undereducated about it because it's such a Puritan society still. So thanks for being a part of quashing that part of our society. I just adore you.
Oh, Melissa, thank you. I feel the same way about you, and I'm glad that you and I can collaborate in these ways. I want to thank everybody who joined today, my speakers. And if you're not following Melissa, be sure you follow her and all of the speakers and follow all the different things that I'm doing. And this is going to be on YouTube too, so I'm really excited about that. But I wanted to tell you that next week I'm going to be interviewing New York Times bestselling author Alessandra Torre. She and I were both contributors to Best Women's Erotica, and we are FSU alum together. So she is a powerhouse in helping authors in a lot of different ways, from Authors AI to Inkers Con, and she is just really open to conversations sessions to help authors get where they go. So Rachel, you and her should really hook up together because y'all got some cool things. I know we did the Inkers Con over the summer. So I want to thank everybody again for coming, and I hope that you have a delightful day. And I will see you next Wednesday, noon Eastern time, right here on this spot. Bye, everybody.